So today I would like to talk about urinary symptoms and fatigue. But first, for those of you who don't know me and you're new to the group, welcome. My name is Dr. Evan Hirsch. I'm a functional medicine MD, and I'm on a mission to help 100,000 people resolve their chronic fatigue. And I'm doing so through this group, through podcasts that are coming, through the online course, through the book that I wrote and the download that you can get, and then through, of course, my one-on-one coaching. And so thanks for being part of it, and please share this information as widely as possible, and so that we can together, because I can't do this alone, but together we can help 100,000 people resolve their chronic fatigue. So today's question comes from Brandon, who is a new member. Thanks so much for this question about urinary symptoms and fatigue, interstitial cystitis, and other urinary symptoms. So let's just dive in here. So let's talk first about what those symptoms are. So oftentimes those symptoms can be pain with urination, anything having to do with the urinary tract. It could be kidney pain. It can be urgency, where when you think about having to pee, you have to go run and pee. It could be frequency, where you're urinating several times a day, up to 11, 12, 20 times a day. It could be getting up at night to urinate. So there's a lot of these symptoms that can happen. And so some of these, oftentimes it's kind of running in parallel with fatigue, where what is causing the urinary symptoms is also causing the fatigue. But unless it's interrupting with your sleep, sometimes it's not necessarily a direct link between urinary symptoms and fatigue. But still very important nonetheless. So let's talk about what's happening. So any sort of pain, dysfunction, irritation that's happening in the body is caused by inflammation. So that's basically the immune system is reacting to something, and it causes an inflammatory response. Now, normally this is a normal response. Inflammation is a normal thing in the body that is really good for you to have, because something happens, the immune system cleans it up, takes care of it, gets rid of it. But when the inflammation is stuck in the on position because of a chronic irritant, that's when you get pain, dysfunction, swelling, redness, heat, all of these signs of inflammation that ends up causing a lot of these symptoms. So a lot of these infections that we talk about, heavy metals, chemicals, all these what I call the usual suspects, and for those of you who are new, usual suspects are environmental toxins like heavy metals, chemicals, molds, infections, allergies, emotions, electromagnetic frequencies, parasites, dental infections. So those are all considered the usual suspects that can cause the immune system to be triggered in this way. So it's kind of like an indirect. A lot of times our symptoms are indirectly related to these things. And so any one of these things can cause these symptoms. So whether you're having interstitial cystitis, whether you're having frequency where you're peeing all the time, or whether you're getting up at night to go to the bathroom, any one of these things can cause those issues. The big ones are heavy metals, mold, and infections. And infections really are the biggest one that I see, because as I start to treat infections, especially these spirochetes, these bacteria that are shaped like spirals that run with Lyme infection and some of these other things, the more we treat those infections, the more I see resolution of a lot of urinary symptoms. So people will come in and I'll ask them, how is that pain when you pee? And of course, we've done testing on this. So, anytime someone comes in and they have urinary symptoms, you want to get a urinalysis. So you look for what's in the urine to determine and make sure that everything's okay. That's usually done through their primary care doctor before they come to see me. And, oftentimes they'll find nothing. And sometimes it's because those urinary tests that are done conventionally are only looking for bacteria. They're not looking for spirochetes. They're not looking for yeast, which is also a huge cause of urinary symptoms. I have one patient who urinates 20 times a day because of yeast, when yeast is out of control. So all of those infections, it's so important to get those under control. Now let's talk a little bit about nocturia, or basically urinating at night. So a lot of people think that when they're waking up in the middle of the night, it's because they have to pee. When actually the reason why they're waking up is because their sleep is not deep enough. and that urge to urinate has never been shut off. So if you remember when you were 18 years old, you could probably drink several liters of water and sleep through the night, no problem. Now, if you drink a glass of water, 8 ounces before you go to bed, you may have to wake up at 3 o'clock in the morning. So why is that? So in our bodies, in the autonomic nervous system that we have, which regulates the sympathetic and the parasympathetic. Sympathetic is fight or flight. Parasympathetic is all the housekeeping things, all the digestion and urination and stuff like that that's happening. When we drop into parasympathetic and we get good sleep and we get deep sleep, that urge to urinate is shut off. You could drink 2 liters, 4 liters, whatever of water before bed, and you're not going to have to pee in the middle of the night. You're going to wake up and you're going to really have to pee, but that'll be like 8 hours later. But when you're not getting that good deep sleep, then you're waking up, or then that urge is not shut off. And so then you have to wake up and you have to urinate. The other thing is also, so what's causing you to not get good sleep? Well, we'll have to go back to the sleep videos to look at that one. But infections can be a big cause of that. Bartonella, Babesia, huge players in sleep. Adrenals, thyroid, B12 have to be optimized, have to be taken in the morning to recreate that good circadian rhythm so that you're getting good sleep. Then taking things sometimes like GABA and melatonin and lemon balm and all these relaxing things, sometimes CBD oil, to really help with sleep at night can help get you deeper sleep, and then you're not waking up to go to the bathroom. So, I hope that was helpful. If you have questions about this video, please leave them in the comments. If you learned something today, please give it a thumbs up and share this video so that we can help 100,000 people resolve their chronic fatigue and maybe their urinary symptoms as well. So thanks so much for being here, and have an amazing day.